Coronavirus, what physicians and dentists know about washing their hands that patients and the public should know. Hello, this is Dr. Donald Fox in Fort Lauderdale Beach, Florida. Some of my credentials are that I graduated #1 in my dental class, invented the light cured permanent retainer, and World Research Award winner in animal studies of birth defects from Tylenol, and started some of the theories about the overdose from taking Tylenol while drinking alcohol or with the flu and possibly with the coronavirus. More credentials can be found out at reallystraightwhiteteeth.com. The more you wash your hands during the day, the better you'll be in fighting this coronavirus. Many questions I'm asked are, do I use warm water, hot water, or cold water? And my hands are getting so dry they hurt from washing them all the time. And what soaps should I use? And what's the best technique to wash my hands? Over 31 years ago in my training, I was surprised to find out it's best to use cold water to wash your hands. Warm or hot water opens the pores to your skin and allows the viruses and the bacteria to enter into your body. Also, warm or hot water takes the essential oils out of your hands and causes dry skin faster. As them getting dried out, you can use a hand cream of any sort, like the one I have here, which is from Burt's Bees, and you spread it all over your hands like this, and be sure that you work it in all the way, because then I put on gloves over my hands so that I don't have to wash them as often during the day. It's easier to wash my gloves than it is to continue washing my hands, because my hands were getting too dried out on my hands and started to hurt, especially on the back sides here. If I'm in the office seeing emergency patients, I change my gloves and I then wash my hands in between every patient, and then I do the same routine and put new gloves on. As far as what soaps to use, hospital and dentist offices, we usually use aseptic or sterilization soaps. But with the coronavirus, the outside of the virus has a fat outer skin that covers the virus, so this fat breaks down easily with most soaps. So soaps aren't that particular, but if I use a soap from Whole Foods, which comes in like a little square here, and it's very gentle and doesn't have any perfumes or scents, that works very good because you're not allergic to it. Then if I touch something that I know is very dirty, then I use a foam soap that I get from Target. And you have to have this dispenser along with this particular solution from this Target, because the foam needs to get inside your fingernails, right around the corners and right where the skin meets the nails, and more importantly, right here on the knuckles here and here where there's wrinkles. Most of the dentists in the country were on a lecture last week and were shown a dentist who washed his hands and looked like he did a very good job, but before he washed his hands, they put on this very invisible liquid that when it was placed on his hands and after he washed his hands, they used an ultraviolet blue light that showed anywhere he did not wash his hands, and all along where the skin meets the nails and on the knuckles, on the top of these knuckles here and here, they didn't get all that liquid off. So the viruses and bacteria can get in there, so you need to wash fully. Women watching this video may not like what I have to say, but 30 years ago there was a research done in dentistry that we took proactive measures, and one of them was that men and women should not have their nails very long, and they should only be a 1/8 inch of that white part that's sticking out above the rest of the nail. In other words, the nails are cut very, very short. This allows to get the bacteria and viruses, and back at that time, the AIDS virus, from underneath the fingernails. If you have long fingernails, that isn't good. Also, research also showed that veneer nails, and you can look this up on Google, were not allowed because of having dirty viruses and bacteria hiding under these veneer nails. And I highly recommend that you remove your veneer nails at this point in what we're going through and cut your fingernails down very short so that you don't pass the virus on to other people or to yourself put the virus in your mouth, nose, or eyes. Another key technique is to always wash your face with bar soap above your eyebrows and on the sides and on the front of your face. So you get into the habit of washing your face first, and then you wash your hands using the foam soap. So I use the bar soap on my face, and then you use the foam soap in the knuckles, and the foam gets all around in the nails here. And if you have a little toothbrush, you could even scrub around the little nails a little bit. And what you end up doing is pretty much like equivalent to like the surgeons do when they're getting ready to go into surgery. You hear them talking about that they're getting ready to scrub up for surgery, but you're going to be using a toothbrush. Then I use Burt's Bees baby shampoo to wash my eyebrows, my eyelids, and eyelashes. Yes, if you haven't figured it out by now, I don't recommend women to be putting on a lot of makeup at this time, because if you do your face washing and wash around your eyes with the baby shampoo, you'll keep your face and eyes washed, but with the makeup on, you have to keep putting the makeup back on. Even though it's baby shampoo, when you use it, I do not recommend washing your eyeballs. Don't get that carried away, because that's too much and it's just going to hurt. Because I wear eye contacts, I use saline solution and flood my eyeballs. I open my eyelids apart like this, and I flush my eyes out with saline solution before I put my contacts in. And it makes it feel better in the morning when I do that. Also, don't forget to wash your face before you put your mask on, so you don't contaminate the inside of your mask, especially if you're having to reuse your mask. Your mask can also be sprayed on the outside with Lysol without drenching it, so that you do it about 12 inches away. Here's your mask and here's the spray, so that the coronavirus is killed on the outside of the mask when you go to reuse it, because many of us don't have many masks and you end up touching it again later on. I highly recommend also that doctors and nurses that only have one mask per day, or they have to reuse a N95 mask over and over for a week, or a surgical mask over and over for a day, and that's true, they only get one per day, is to put a towel first over the outside of the mask, and then you put the mask on with the paper towel on the outside and tuck it in around the edges. If you get it tight against your face, you can trim the inside of it with some scissors, so that you're not only having the paper towel on the outside, so that when you take your mask off, you throw the paper towel away that has the coronavirus on it, and then you put a new paper towel on when you go to put the same mask back on again. This is a lot more hygienic, and not worry about all the splatter or spit that somehow is in the air if you're working on a dental patient, if you're a dentist, or if you're an emergency room physician and you get some sort of blood splatter or any moisture on the outside of the mask, and then it's hard for you to reuse that mask, and you'll feel a lot safer. You could even take dental paper bibs that dentists we use on the patient's chest, and one side of the paper has plastic and one side has the plastic on it. And then what you do is you put the paper side outward. This will not allow any blood or spit to seep through and get on the outer part of your surgical mask or your N95 mask. This would be an awesome technique under the circumstances until we get enough surgical masks and N95 masks for all of our healthcare workers, which may still be 4 to 8 weeks from now. This is now April the 5th that I'm doing this video. I hope this helped. Again, go to reallystraightwhiteteeth.com to see previous videos on how to get the coronavirus out of your mouth, nose, and throat. Videos, another one, how to make a paper towel in a matter of 3 to 4 minutes, and also how not to overdose with Tylenol or paracetamol while drinking alcohol with the flu or with the coronavirus. It only takes a little bit of Tylenol to overdose. Very dangerous. Stay healthy. Dr. Donald Fox in Fort Lauderdale Beach, Florida. Thank you.